Hello.
Hello. Lovely to see you. You're becoming a regular.
Hello,
getting
Camilla,
the
can you hear
Sunday
me?
round. Yes, I can hear you. If you can hear me, we're good to go. Can we talk about the fact?
We're good to go.
Can we talk about the fact that, I mean, I've written this in the Telegraph yesterday. I thought Rishi Sunak had a good first campaign week and that you've done well. You know, you've landed your policy ideas. Labour have been caught up in this mess about Diane Abbott, but the polling is still dire. We've got one MRP poll predicting that you're going to win just 66 seats. Why can't the Prime Minister move the dial? Why is he still much less popular than Keir Starmer?
Well, good morning, Camilla, and everyone watching. We know that the only poll that matters is the big poll on polling day. And what we're doing across constituencies across the United Kingdom is ensuring that we're putting our policies forward, that we're showing the great work that local candidates and former members of Parliament have done for our constituencies and delivering on those promises. My job as Health Secretary, for example, is to explain our vision for our NHS, which is to reform it to make it faster, simpler and fairer. And some of the announcements I have today concerning GP surgeries, concerning Pharmacy First and community diagnostic centres are the ways that we will help deliver that over the coming years.
Don't worry, I'm going to ask you about your plans for the NHS in just a minute. But just on this polling and the Tories' popularity or lack of it, there was this extraordinary poll in the week suggesting, I think it was YouGov, suggesting that the Greens are ahead of the Tories among the under 50s. Have you just given up on the young vote and are now just going for what's been described by the Sunday Times as the grey wall? Because you've basically offered young people maths till 18 and national service. The competitors, Labour, are offering young people votes at 16 and 17. So have you just given up on the 18 to 24s?
Absolutely not. And if you look at our plans, not just for the National Citizen Service, which I have to say, I think it's a great idea to be able to give young people that on the cusp of adulthood, that opportunity to see other parts of the voluntary network or to enter military service. I think that's a real range of opportunities for our young people. And that's about ensuring that they have the skills and the qualities for later in life. But also, of course, we've given a tax break this year of £900 to people of working age through the National Insurance tax cut. And what is more, we have said that we want to ensure that pensions, those workplace pensions that we've done so much to encourage people to invest in, it can be very difficult at the very start of your career to invest in your pensions, but we've done that through our workplace pension work. What worries me is that Labour is absolutely silent on whether or not they're going to raid those pension pots. We have made it clear we will not, but Labour has not. And it is these incremental policies or silences from Labour that is, I think, building a very different picture from the one that perhaps they like to come on the camera and talk about. We have to look at the evidence behind it.
Let's look at something that Starmer has not been silent on today, because he's given an interview to The Sun on Sunday where he's pledged to bring down immigration. I'm just going to quote the Labour leader. The Conservatives repeatedly say they are going to cut these numbers. They have never done it. They have completely failed. It's quite hard to disagree with that assessment, isn't it, Victoria Atkins?
Well, sorry, he's very late to the issue. He has consistently voted against every single measure that we have brought before the House to tackle illegal migration, some 100 times. That's not an oversight on his part. That's a determined policy not to tackle illegal migration.
But the numbers have gone up under the Conservatives.
Well, on illegal migration, in fact, we saw last year small boat crossings falling by a third because of the programme of measures that we have put in place. Now that we've got the Rwanda policy into law, we know that that will act as a deterrent too. But on legal migration, there is a delicate balancing act between ensuring that we attract the brightest and the best, but also that we manage those numbers down. And actually, the fact that so many people have come on the health and social care care visa route, again, belies the misery that the Labour Party likes to paint about our country, because we know how popular and how much people want to come from all over the world to work here. But we must manage these numbers down. And interestingly,
manage them down to what?
Previously criticised. The Labour Party has previously criticised our policy around salary thresholds and so on. Well, the Independent Office for Budget Responsibility has said that our measures that we're bringing forward to tackle legal migration will see legal migration halved by June next year, down to 336,000.
336,000 is too much, isn't it?
That's the OBR's prediction. And of course we will monitor these policies, and we will ensure that as we go forward we are trying to bring these policies down further. And in the health space and social care space, what we've also wanted to do is ensure that we are training our domestic workforce to take on these important jobs. So we have record numbers of doctors and nurses in the NHS today, thanks to record levels of investment by the government. But what we want to do is train even more doctors, nurses, GPs, dentists and midwives. And through the long-term workforce plan that we introduced last year, we are already seeing medical school places increasing. We're seeing nursing retention and recruitment increase. We want to increase GP training by some 50% by the end of the decade, so that we have a really, really strong workforce here in the UK with the measures to manage migration, whether legal or illegal.
OK, I mean, some people watching and listening to this will be saying that 336,000 legal migrants into this country is completely unsustainable. But just in reference to your point about the NHS workforce...
So that's the first year, yeah.
Yeah, OK, yeah. But, you know, we had pledges... we've had pledges from the Tories about tens of thousands, which now look utterly... They don't just look ridiculous, they just look like lies.
Well, in this general election campaign, we are going into the campaign with this raft of measures to tackle both legal and illegal immigration. You know, the Prime Minister has put a lot of effort and political capital into tackling illegal immigration in particular. And if you'd said to me 18 months ago that we would have cut small boat crossings by a third, I would have been happily surprised. But we have achieved that, and we've done that through a programme of work, not just Rwanda, but across the board.
Just on this point, that's all well and good, but you're having to reverse your own numbers, because all of this has happened under 14 years of Tory rule. But let's talk about the NHS. You make this point about record spending on the NHS and indeed record numbers in terms of recruiting doctors and nurses. And yet we discovered last month that productivity in the NHS has gone down by 15%. The NHS is now less productive than it was before COVID. What's going on?
Exactly right, and this is why. So before COVID, that decade of Conservative governance and NHS England being set up, we had productivity of around 2%, which compared very favourably with the private sector. But with the pandemic, it took an enormous toll on the NHS. We all understand that. And since then, even though we have record spending, as you've said, even though we have more clinicians, more nursing staff, and more admin staff than ever before, we have not reached those levels of productivity that we want to see, which is why at spring budget the Chancellor put forward the productivity plan worth some £3.45 billion in order to drive up productivity. And so we have a plan to improve productivity, and it will include things such as using AI in clinicians' appointments, so that clinicians aren't spending 25% of their time tapping away at a keyboard looking at the screen. That is greatly reduced, and we think it will free up some 13 million clinician hours when this comes through. That's just one measure that we're looking at. We want to roll out technology for frontline staff, so that we're not having, nurses and doctors aren't having to take ages to log on.
I want to ask you about pharmacies.
Also, we're using AI on scanners, which is great news for people who are waiting cancer diagnosis, because we know that they can diagnose cancers so much more quickly. So there's a real plan there.
Let's talk about pharmacies. I mean, this Pharmacy Plus, Pharmacy First scheme should be welcome, not least because under Theresa May, the Conservatives tried to slash the number of community pharmacies. I remember it vividly because we campaigned against it vociferously on the Sunday Express. So this is progress, although the National Pharmacy Association has said this is worrying. You're not paying pharmacists enough. And also, when it comes to the issuing of serious shortage protocols for drugs, this means that medicines aren't available to pharmacies. They're up by an astonishing 230%.
So let me deal with Pharmacy First, then I'll come to medicine shortages. So Pharmacy First, we launched this at the beginning of the year, and in its first month we saw some 120,000 people being looked after under Pharmacy First. It shows that for the 7 most basic conditions, the more comfortable we all become with the programme of Pharmacy First, the more people will start to use it. And this is important not just for pharmacists, because we want to use these highly skilled professionals to the top of their licence. It's also important for you and me as patients. It means that we can get access to healthcare much, much more quickly than if we are waiting for these most basic conditions through GP practices. It, of course, also takes some of the heavy lifting off GPs, and we think this first tranche of Pharmacy First will free up to 10 million GP appointments when it's at full scale. So we're building on that, and we're now increasing Pharmacy First to women who have contraceptive needs, to women who want help with their menopause, but also to people who have skin and chest infections.
Okay.
All of this, of course, done with clinical advice. That's the absolute priority. And what is more, with pharmacy, the first tranche of Pharmacy First, we have put some £645 million towards it. We have 98% of pharmacists now signed up to it. With this second tranche, we have said across the board with Pharmacy First, with GP surgeries and with these new community diagnostic centres, we are going to fund this. It's fully funded. We're going to fund it partly through a reduction of managers in the NHS. We talked about productivity earlier on. There are now more managers than before the pandemic. We want to bring it back to pre-pandemic levels, but we're also tackling the use of management consultancy across government.
But just before you answer the drug shortages thing, hang on a second, sorry, just before you answer that, just yes or no answer. Theresa May was completely wrong to try and slash community pharmacies, wasn't she? Yes or no?
Well, we know that, I think community pharmacy has a really important part in our healthcare system, both on our high street, but also the expertise, of course.
So the former Prime Minister was wrong. Why can't we just admit that?
So what I'm trying to say is that this Pharmacy First scheme is a brand new scheme. It has come about because of Rishi Sunak's experience of having
but Theresa May tried to do the complete opposite. So she was wrong. It's okay to admit that. We can all admit that now.
No. What I'm trying to say is that we know that pharmacies actually, we have 4 out of 5 people across England are within a 20-minute walk of a pharmacy. So I'm not familiar with the policy that you're espousing.
She tried to slash community pharmacies.
I'm doing everything I can.
Okay.
Well, I'm not familiar with that policy. I'm being honest. I as health, all I can focus on is what I can control, and what I can control is the rollout of Pharmacy First and the expansion of Pharmacy First. Now, coming on to medicines shortages, we have some 14,000 medicines that are licensed to be used in the NHS. The overwhelming majority of those medicines have no supply issues. They're available. There's nothing to be concerned about. We know that with at every point in our medical supply chain, there will be occasions where, because of international factors, whether it's in the supply chain itself or with the manufacturers, they may have difficulty creating or developing a particular product. This does happen, sadly, from time to time. And this is why the NHS has very established protocols in place, including with whether alternative medicines can be used, whether different dosings can be used, and so on. So there are very established protocols. We are doing everything we can to try to get the supplies from manufacturers for some of those medicines that we've heard about over the last few months. But it's really important that people feel reassured that we're able, the overwhelming majority of medicines, there are no supply chain issues and people are able to get the medications.
Victoria Atkins, you've been really, really generous with your time this morning, and I'm very, very grateful for it. Thank you so much.
Thanks.